Welcome to the Ultimate Dentist podcast. Join us to hear success stories of various individuals and learn clinical and life hacks to help you become the ultimate dentist. Hi everyone. In this episode of the Ultimate Dentist podcast, we are discussing importance of mindset. It has been said that the best way to predict your future is to create it. And that was said by Abraham Lincoln. Instead of thinking, I cannot do this, you need to think, how can I do this? And this has got me out of a lot of difficult questions and almost avoided me going through hard times, burnout, depression, all sorts of time, because when you are stuck in a situation where you don't see any way out, if you ask question, yes, I understand there is no way out, but if there is a way, what would be that way? And you think that, oh, I cannot do one thing or the other. Rather than thinking about that, think, yes, I understand at the moment I cannot do this, but if I were to do that in future, how can I do this? And changing that one question has helped me tremendously. And that shows the power of mindset. And there are a lot of limiting beliefs we have associated with dentistry. So, what are the limiting beliefs dentists have which may stop them from achieving their best potential or possibly preventing them from doing full mouth reconstruction? One of the beliefs, or let's go through all of them together and then I'll break them out down one by one. So, the limiting beliefs are beliefs which you think in your mind, which you think you cannot do, is preventing you from doing the thing you want to do. So some of the limiting beliefs I have come across by dentists, or I had it myself, was I'm not good enough, I do not have enough experience, I need to be a specialist in order to carry out full mouth reconstruction, it is very difficult to learn full mouth reconstruction, I do not have enough money to be able to invest in the course, my boss will not pay for the instruments and material I need, so no point in doing the course. What if I get failure or complication? I do not have patients who can afford this type of treatment. I work in a busy general dental practitioner-led practice, doing checkups and simple dentistry, and my practice is not geared towards complex treatment. And these are some of the limiting beliefs I come across all the time from the dentists I teach or I talk to. So let's look at them one by one. So one of the limiting belief is I'm not good enough or I do not have enough experience. And this is a sign of being actually a good dentist who cares about their patients. You won't be good enough nor you will have experience until you start doing treatments. You need to accept that you won't be as good as you will be in 10 years' time. But just because you're not going to be as good as you're going to be in 10 years' time, or if someone else is, for that matter, it doesn't mean that you cannot do that treatment. We all were beginners at some point. I remember an episode when I had really terrible kidney stone pain. And those who had kidney stone pain, they understand how bad it is. And I was in agonizing pain. And I was in hospital and they needed to give me morphine because I was really sweating and I was almost going into sort of unconsciousness. And I had someone who was a trainee nurse giving me IV injection, and she couldn't find my vein. And I remember very, very clearly, even at that time, that her mentor, looking at my pain, wanted to take over. And I said, no, let her be, because I know I could hold on a bit more longer. But I wanted her to have that experience because I remember my first ever case, and it was lower left 5, DO cavity. And in my days when I was doing undergraduate, we started using slow handpiece first, and then we were given fast handpiece. So that patient was the first time when I was given fast handpiece. And literally, I because if you go from slow to fast, you don't understand how fast the fast handpiece is. And I applied a lot of pressure and within seconds I was in the pulp. And from simple class to cavity, I turned into a root canal treatment. And I'm always grateful for patients who have allowed me to learn, allowed me to become who I am right now. And that's something you need to understand as well. Until you start something, you're never going to be great at anything. So, of course, you need appropriate training and guidance, which plays a big part in achieving great success. So I'm not saying just watch, something and, just go ahead and do some treatment. I'm saying that, have appropriate training and mentorship or whatever you want. Make sure that you have all the pathway cleared, and then you attempt that case. But make sure that you do attempt. Just because you think that you can't do it shouldn't stop you doing it. But you need to actively seek for training and mentorship. Otherwise, again, you will not be able to achieve what you want to achieve. The other limiting belief people have is I need to be a specialist in order to carry out full mouth reconstruction. Now, I've seen many dentists who are not a specialist. I am not one, so I'm not a specialist, and I still do almost everything what dentistry has to offer, surgically, non-surgically. And dentistry is one of those field where you do not need to be a specialist to do 99% of the things. If you can prove you have received appropriate training and guidance, you don't need to do a specialization, MSc, diploma, certificate, or anything like that. As far as you have structured guidance and training, you can do whatever dentistry has to offer. There are not that many areas of dentistry where you have to be a specialist. Now, I'm a general dental practitioner and I can do root canal treatment, implants including block grafting, sinus lift. I can do orthodontic treatment, full mouth reconstruction, crown lengthening, gingival graft, soft tissue surgeries, periodontal therapy. So I can do a lot of things. But yes, I've spent years, getting trained in these from the top specialists and top clinicians. Some of them weren't even specialists. But you need to understand that degree up to certain extent doesn't matter much. It's the training. Yes, if you're getting the same training doing diploma or MSc, just go ahead. Yeah, that's fine. But don't feel that MSc or doing masters or being specialist is the only way to get there. Don't be limited by thinking that you have to be a specialist. Of course, if this is what you want to go ahead and do it, then please, carry on. And yes, there is a merit of having some degrees behind you, and that helps you as well. But in my personal experience, I felt that becoming a specialist may restrict you in doing other aspects of dentistry, which you really enjoy. So if you really enjoy 360-degree dentistry, like me, then just being, let's say, an orthodontist, you might be limiting yourself to doing orthodontic treatment. And so that's something you need to consider. But if you do want that way path, then by all means go and get the training done and go towards that path. The other limiting belief I hear from dentists is that it is very difficult to learn full mouth reconstruction. And I understand full mouth reconstruction as a term may sound daunting, but if you think about it, if you can do single crown or single build-up, then all full mouth reconstruction is doing 28 build-ups out of 28 crowns in one patient. And the difference is learning occlusion, which is also very simple. All you need to make sure that when patient is closing his or her teeth together, it should be comfortable, they should meet harmoniously. And when they grind their teeth, which they will most of the time, considering current climate and society we live in, they should protect each other. And that's a simple definition of static and dynamic occlusion. And yes, people can make things complicated, and I sometimes make things complicated when I'm teaching. But all you need to understand is, in a simple term, it needs to be comfortable for patient when they are functioning and parafunctioning, and you will be fine. Yes, it may feel daunting, but as far as occlusion, it's really your single tooth dentistry doing multiple times in single mouth. The other limiting belief people have that I do not have enough money to be able to invest in the course. Now, this is very funny because what if I tell you that I can give you a machine which will print you money for life, and that machine will cost you £9,000? Will you pay for it? Let's say a full mouth reconstruction, the first case, which could be in region, if you're doing direct adhesive full mouth reconstruction in UK, could be in region between £8,000 to £10,000. And your lifetime income from that skill, if you work for, let's say, 30 years maybe, and if you have 6 cases a year, which is very reasonable, if you have 1 case every 2 months, then the expected income is £1.8 million over your lifetime. Now, wouldn't you be able to spend course which is worth £10,000, £20,000 maybe, £30,000 to learn that lifetime income? So for me, spending money on learning is a no-brainer. In dentistry, we are in a profession where we can earn whatever we learn. If you implement that, we can earn that money within a year, no matter what course you're doing. So you need to look at a lifetime value of any course you are doing. And sometimes you just need to do it for fun, to make your life more happier and meet like-minded people. And sometimes you get tips from the courses which is not coming from the teacher itself, it's coming from the cohort or the dentist. And I've learned so much from going through courses and learning from other colleagues during those courses, the tips and materials, because sometimes the mentor or teacher would have come across the difficulty which the students come across. And meeting like-minded people, you may find a small gem of information which will enhance your clinical skills. The next limiting belief I get is my boss will not pay for the instruments and material I need, so there is no point in doing the course. And to them, I would say, pay for yourself. Pay by yourself, and think about how much is costing you by not doing or not learning whatever the skill you want to learn. So, I invest in all my equipments. I don't own my practice yet, and I still have my intraoral scanner. I have my own implant motor equipments. I just need a chair and a room, and I can work in any surgery. So I'm like a mobile dental practice because I have all my instruments, which I use. And I never regretted that. You will always make your money back. The other limiting belief I get is, what if I get failure or complication? And here's the thing, you will get complications and failures no matter what level of dentistry you do. If you haven't yet, then you haven't done enough dentistry. However, controlling or reducing the rate of complication and failures and learning from others' mistakes is where you should focus. So you shouldn't focus on not having failures or complications at all, but learning from it, and maybe learning from others' failures and mistakes. And this is this podcast is about, learning from other people's mistakes, other people's failures, or other people's struggles, so that you can achieve those success with less failures and struggles. But you will come across your own failures and struggles. And again, you need to have support network where if such thing happens, you can go to that colleague or mentor who can help you find the solution. Also, one thing which has helped me a lot in the past when complications happen was a good rapport with my patient. Because of that, patients were understanding, although disappointed, as me as well, but we work together to find solution. So you can really do whatever treatment you like to a right patient. And you need to really work on your communication skills before you start doing these type of complex cases, because most of the time, if anything goes wrong or complication happens or failure happens, the only thing which will save you is your rapport with patient. The other limiting belief I get from dentists is that I do not have patients who can afford this type of treatment. I work in what they call in America, they call it Bronx, I think, where there are not that many affluent people or rich people live. And in my opinion, my experience, I've worked in different part of UK, from central London, where I've treated some very rich people, and I've worked in very rural areas. And what I can tell you is that patients are everywhere. I would even argue that patient in low socioeconomical area, you will find more patient in low socioeconomical area than rich area, because they may have worked hard for to make their living, and they might have neglected that oral hygiene, and they might be in a situation where they have to do something. Have you ever been in a situation where there is a tipping point? For me, when I am getting overweight, there is a tipping point. Up to certain amount I will tolerate. After that, when it tips, I'm back onto my diet, my exercising regime, and everything. And yes, I should be doing that at all the time, but sometimes you let go things, but there's always a tipping point. And you will see this in many people who had a health scare. People who had a health scare and had some issue with their health, they all of a sudden becomes very much health conscious, and that becomes their first priority. And this is what happens when in low socioeconomical area, that they have neglected their mouth, but there's something happened there, abscess on the tooth or something, and they said, this is enough, and now I can't tolerate this, and I want to get something sorted. And you find a lot of people like that. You find a lot of retired people who worked whole their life, they had never had time to spend time on themselves, and then they want to do some work done. So I would say there is no area which is good or bad when it comes to doing dentistry. Everyone have, or majority of people have teeth, and they want to look after their teeth. Even if people who haven't got teeth, they would want fixed teeth, or they would want treatment to make their journey comfortable. And again, dentistry can help them with that. So I want you to take that limiting belief out, because you have a living example, me, who have worked in different type of areas and still managed to find patients who will fit into the criteria of the treatment you want to do. The other limiting belief I find is that I work in a busy general dental practice, doing checkups and single dentistry, and my practice is not geared towards complex treatments. So as I discussed before, all practices are geared towards a good dentistry. And this is not about complex or simple dentistry. This is about complete dentistry. So let's say patient come to you for a checkup, and you find that all the teeth are in a good condition and just one tooth needs dentistry, then you'll do that. But what if patient comes to you and patient needs full mouth reconstruction? Now, if you are a general dental practitioner, if you're just doing simple dentistry, you're not going to offer that dentistry to that patient. Of course, you have to, because that's your responsibility. That's the reason patients come to you, to get your professional opinion on something. So even though whether you do the treatment or not, you need to propose that. You need to tell the patient that you need a full mouth reconstruction. And of course, if you do that kind of treatment, then do you think patient's going to say, no, let me go somewhere else and have the treatment done? Or if you have built that trust and rapport with that patient would say, you know what, doc, you do it. I want you to do the treatment. And if you have good rapport with patient, I would guarantee you that the patient would want you to do the treatment, even if patient think, or you tell patient that, you haven't done this stuff case before, this is your first time. And in my experience, patients are very accepting to the fact that you are learning. And I tell even my patient that the reason we call practicing dentistry is because we are never perfect. We are always practicing. And that's what's called practicing of dentistry, or practice of dentistry. And I explain that to patient. We are learning all the time, because I take photos so many times, and patient keep asking me, like, why are you taking so many photos? Because I'm learning. I'm teaching. I'm using these photos for teaching, but I'm also learning, because when I look back 10 years down the line, see my cases, and I see how much improvement I've made, and what I can improve. So, whenever you're doing a checkup, you need to think about, how can I give this patient their oral health back? How can I help? What needs doing to give them the teeth they had when they were young, before the teeth got into the situation they have right now? So if you think that way, you will always find a way to communicate with patient, in order so that patient understand what they need. So I hope I've made you rethink some of the beliefs you had, and I hope this helps you in making progress and achieving higher success in dentistry and life. So thank you for listening to this episode, and I will see you in the next episode.